When I first heard of the pandemic, one, I didn't believe that it was really happening. I thought, oh, this is just a cold or a flu.
I felt overwhelmed by how it was going to affect everything.
Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan.
I have today declared that the coronavirus presents a public health emergency in the United States.
The first thing that went through my mind when I heard that there was going to be a pandemic is how are we going to maintain safety in our shelters? The second thing was how are we going to continue to provide the services to our mentoring clients, counseling clients, and hospital clients, especially being that we couldn't do it in person.
We all went into a moment of fear, right? But also action. I think we came together as a team to figure out how to protect our staff, our clients, our own families.
The day that I got the phone call saying that we were shutting down everything was in March. For safety reasons, we were gonna have only the most essential staff.
So a couple of obstacles that the team had to overcome was one, some of our clients didn't really believe that it was a pandemic. So enforcing just, social distancing, wearing your mask in common areas, that was very difficult, and it's especially difficult for little ones.
At the time, our policies stated that all counseling services needed to be in person. We weren't allowed to have counseling sessions over the phone or virtually. It wasn't something that we did as an agency. So I knew it was going to uproot a big part of what we do. If we shut down, how do we have access to talk to the callers and what's going to happen to our clients and how we offer them services?
Now, when everything went onto lockdown, these clients were at home with their abusers. So it was very difficult for them to meet with their mentors. So they got very creative. Mentors would talk to them about, say you're going to the park with the kids, say you're going for a walk, and that's when you would make the calls.
We all came together and figured out a way of how we're going to keep staff safe, how do we keep going with services, how do we help our clients who are in the same situation that we are in our own personal lives, and then for the ones that get COVID, how do we get them pantry, how do we get them food? So that's what we did. We honestly came together as a team.
We learned during this experience how to be creative, to come up with so many different ideas and activities of how we were going to be able to still provide counseling services to these children, to these parents.
We actually got more donations, more gifts around the holiday, more food. It was just, for some people, I felt like it was a time of abundance actually for the shelter.
We would have all these meetings, with Rebecca. So all the managers got together and we were just all the time meeting. And then we were all the time talking to our staff. And then we were all the time trying to figure out how to help our clients.
You asked me if I would consider myself and our team heroes. I first and foremost see our clients as our heroes and what they get through. I think that we're just there to support them, and I commend our staff so much for being able to both take care of themselves and have enough left over to also take care of our clients.
What I would say to my team that got us through that time is I wouldn't have wanted to go through it with anyone else.
We had a virtual Christmas party where we had dropped off cookies and frosting and activities to each of the families. And so we put Santa in the breakout room, and each of the children would be able to talk to Santa about what they wanted.
Yeah, talking to members of my team now, I want to give the biggest high five because one, we can stand close to one another now, but then it's just the hugest thank you and how much we've gone through and made it. And if we can get through this, we can get through many things.
We are Wings.
We are Wings.
And we are strong.